Hey, it's Meredith Harris at New Life Aesthetics, and I'm here with Jen today. We're talking about a new innovative technology that uses low frequency to interact with plasma, which is one of the 4 stages of matter. So we have liquid, gas, solids, and plasma. And plasma is the energy that's at the top layer of our skin. When we use this low frequency device, we're able to interact with that plasma to deliver heat into the epidermis, which is a very superficial layer of the skin. And that heat generates new collagen deeper in the dermis. And the whole idea here is to be able to treat for wrinkles, tightening skin, and just giving a fresher look to skin. We can treat things like seborrheic keratoses, which are brown spots on the skin that really aren't easily lifted with other types of technology. The neat thing about this particular plasma device is that it's low frequency, different than high frequency of other types of plasma pens. This is a newer technology. It's much safer. It's a much more modulated and easy to deliver form of the energy. And because it's not as deep and it's easier to modulate, it's a much faster recovery for patients with fewer deep scabs. So the scabs that you see will be more superficial, again, forming at the top layers of the skin, but the deeper energy is what gives us that beautiful collagen stimulation. While I'm treating Jen today, she's looking a little bit shiny right now, and that is the appearance that we get from application of topical lidocaine and tetracaine. It's a very strong compound that's made for this purpose to really give her a great, comfortable treatment experience, and that's really important here at New Life. And so as I'm treating, I'll be removing this ointment in different areas to be able to treat her, but keep her numb in other areas while we're treating. So as we're treating the neck, we'll keep her face numb, and we'll just remove that as we go. So this is a very normal sort of shiny or splotchy appearance, but yesterday we worked on her chest. Today we'll be working on the neck and the lower face. The chest, we were treating some of the deep lines that are formed by old sun damage. It doesn't treat pigment, but it does treat for the tightening of those chest lines. And so a lot of women are very concerned about the crepey texture of their chest. And then moving into the neck area, we have such a beautiful cosmetic outcome by treating the neck. We get some really nice tightening, especially for what women will sometimes say is their turkey neck, where they have that loose hanging skin. We also treat behind the ears, which offers a tightening vector that's kind of unique to this device. As we are watching the results of the treatment, you'll also find that the horizontal lines, called the necklace lines, are really nicely treated also. Subnovii takes about 3 months to get to the final results, but you will see results as soon as the scabs start to fall off at about day 5. And by 2 weeks, we're seeing really beautiful cosmetic outcomes, with the best results coming in about 3 months. So as I'm working on Jen today, we'll move from the neck up to the jawline, and you'll see that she has some pigment. She has a seborrheic keratosis here and a few other dark brown spots here. I'll be lifting that pigment. I'll also be working in what we consider the sleep lines, or the cheek lines that form, and I'm just going to turn you. Many women get these lines right through here from either their position while sleeping or loss of collagen in that thinner skin of the cheeks. We'll also work across the upper lip, because those lipstick lines are stubborn, they're hard to treat. Some women are very hesitant to have filler there. So we're going to be working in that area to really just resurface and treat those lipstick lines. And then across the chin, she has some scar tissue from just old acne scars, and we'll be treating those also. So it's a really comprehensive treatment that treats stretch marks, scar tissue, wrinkles, folds, tightened skin, with very little downtime. By day 5, the scabs will be falling off, and what she'll see left behind is just a fresher skin that tightens with time. When she has seen those scabs fall off, we'll follow up with Jen at about a 1-week time period. We'll repeat photos at that point, check her skin, make sure she's not showing any signs that would be concerning to us. And then from that point forward, we'll monitor her progress through treatment. And in about 3 months, what we'll be able to see is some beautiful outcomes. And what I love is to compare our 3D imagery So we have a 3D imager that is very unique to our site here. This imaging allows us to take 3D images, put it in all different positions, and to compare and contrast that pre-treatment photo with the follow-up photos. And it's really great because at 2 weeks you can start to already see changes, and at 3 months you're really going to see them. So it's great technology for our patients, but it's also great for me to be able to monitor that successful outcome. So with that, I think Jen and I are ready to get started with her treatment, and we'll be laying her back, cleaning off her lidocaine and getting started. So we've got Jen all cleaned and prepped on the neck area. That's where we're going to start first. And just to show you our device, the Subnovii device is a really easy portable device. It's one that I do have to use a smoke evacuator for, which is to my right. And for the patient's comfort, I actually allow the use of our cryo device to blow really, really cold air on the skin, which gives them great comfort. It's another anesthetic, if you will. As I'm using the device, I have a disposable tip, and as the tip is lit, as it comes close enough to the skin but not in direct contact with it, it'll interact with the plasma layer above the skin, and you'll see a tiny little spark. And that little spark is what leaves these tiny scabs on the skin. And you'll see me use all different types of techniques. It might be a dot technique. It might be little scratches that are more of like a shower technique where I shower the energy over. But all of those things create different outcomes. When we're working on pigment, it'll be even different. I kind of color in the lines. So you'll see different techniques for different purposes. And with that, I'm going to get started. So Jen, I want you to go ahead and start to cool that area. And she already knows the routine. I prompted her to let her know I'm going to just lay this here so that my hand doesn't touch that lidocaine that I've already applied. And as I go, I'll wipe off the tip every once in a while so that we can keep it nice and fresh. I'm going to get started. I'm going to go behind the ear first. This tends to be the most uncomfortable spot. But it's a great place to get tightening of that under chin area. We'll go all the way down to the clavicles where we've got some crepey skin here. It's kind of thin, so we want to help those little textural lines. And we'll meet up with where I treated her chest yesterday. And this is all freehand work, so if you're an artist, you'll appreciate the art of this. And of course, really light-handed touch. She's not really feeling anything from what she's said, so that's a great level of comfort for her. And the patient really won't experience any bleeding from these scabs. They're so superficial. The aftercare for this is very minimal. We just ask that a patient applies the cream that we give them. That's a healing cream. And right after that thin layer of cream, they'll apply a powder with a cotton ball, and they just dab that on. And they do that twice a day for 5 days or so until the scabs fall off. The nice thing about this treatment too is not only is there minimal aftercare, but the bit of sunburn kind of stingy feel to the skin is minimal, and it goes away quite quickly. So I would not recommend that there be any direct sun exposure while you're healing, and certainly it'd be very important to wear sun protection after treatment to maximize the benefits of the treatment. For the cheeks in general, I'm going to be doing some just showering strokes here. The next thing I'm going to do is work on some of the pigmentation on this right cheek. She's got a few seborrheic keratoses that have not successfully lifted with other laser procedures in the past. So I'll use that coloring in technique that I mentioned earlier. See the pigment lift right off on that Q-tip. That's gratifying. Thanks so much for being with us today. We finished Jen's Subnovii treatment up, and we are super excited to bring this technology to you, the low frequency plasma pen device. And it treats for fine lines, deep lines, scar revision, for pigment, you name it, for all kinds of skin rejuvenation. We're excited to have some time with you to consult and figure out how this might uniquely be able to treat your needs. Thank you so much. We look forward to seeing you soon.